I was taking a shower and I had felt the lump, and I thought, what is this? It just kind of puzzled me. I had breastfed my son, so I didn't think it was anything to be concerned about. I thought it was just a milk duct. And I didn't seek treatment right away. I delayed it nearly a year, and the lump grew and hurt. And so I just knew that whatever was going to happen, I had to go get it taken care of. And I met with the surgeon a week later, Dr. Locke at Marshall Medical, and we did a biopsy. And that following Monday, I was called into his office, and he told me, "You have cancer. It's stage 3 invasive ductal carcinoma." And so I had a bilateral mastectomy on July 16th. So I didn't want the cancer coming back. Dr. Locke's office referred me to Carol Case, who is a patient navigator at Marshall's Cancer Resource Center.
My role as an oncology patient navigator is to work with the patients who have been diagnosed with cancer. And I work with a wide variety of patients because they're often very scared, they're confused. When you hear the word cancer, you just shut down oftentimes and don't hear everything that the doctor's saying. Patients often don't know what to expect. They don't know what treatments they're going to have. They don't know how long the treatments are going to be. They don't know how they're going to feel, and their world is just turned upside down. So our role as a navigator is to begin working with them at just shortly after the time of diagnosis and start doing some education, some counseling, some assessment of what are their needs right now that we can provide them, and they change over a period of time. And so I'm working very closely with the physicians that provide their care, and the nurses that also provide the care, and dietitians and social workers. And what we're trying to do is make this journey for them. While it can be very difficult for them, we want to try to ease as much of the fear of the unknown as we can. And what we're trying to do is find out what kinds of questions do they have, what kinds of concerns. Are there some barriers that will prevent them from accessing care? For instance, some people live alone, and if they're starting into treatment, it's going to be difficult for them to drive to get to and from. And so one of the wonderful things that we have at the Resource Center now is a car has been donated to us, and we have volunteer drivers, and they are picking patients up and taking them to treatment and then taking them home. We have designed our Cancer Resource Center to meet the needs of our cancer patients as much as we can, to provide a lot of the complementary and supportive care programs that they find very helpful. For instance, we have for women who are undergoing chemotherapy, many of them will lose their hair if they have breast cancer, for instance. And so we offer a program called the Look Good, Feel Better program, and it works with our patients. There are a team of volunteers that come in and provide makeup and hairstyles and wigs and turbans and hats and provide customized care for our patients. There's usually maybe 3 to 5 people in that class, and they walk out of here feeling like $1 million because they look so good, and it just makes them feel better. We provide a lot of fun, creative things at the same time. We have painting silk scarves as a class. We have stress reduction programs. We've had yoga. We try to make it as comfortable and easy for them to, while they're undergoing treatment, or even if they finish treatment, they can come back into the Cancer Center to take some of these classes.
Through breast cancer, I feel that I've been blessed. It's a terrible disease, but I plan on going to school for my nursing, and I want to work in oncology. Breast cancer is not a death sentence. It's a new beginning.
Marshall's nationally accredited cancer program has board-certified oncologists and surgeons to care for patients. Grant-funded, low-cost or no-cost breast cancer screenings are also available.